Kidney stones are minerals that are deposited within the kidney. Mainly, they are made up of calcium, uric acid, and other rare elements. The stones are formed for a number of reasons. It is both nature and nurture. So there are genetic issues with it. So some people are born with families having stones, like cystinuria, for instance. Most of the other stones, they just develop randomly. There are some genetic changes, like how it happens in diabetes, for instance. But most of the other things that happen is because of our diet. The stone is a disease of prosperity. The more protein we eat, we get more stones. And that's why the stone is a problem of the Western world. Although many Eastern countries also are forming a lot of stones nowadays. The second important thing is the amount of meat intake. The red meat can form stones. The important thing to realize is that most good things in life can form stones, like red wine, the chocolates, the nuts, etc. But we should eat everything in moderation. The stones present in a number of different ways. The small stone in a kidney, in the lower part of the kidney, may not even show any signs for the patient. All the stones are formed in the kidneys. But as the stone gets bigger, very large stones can be there without causing any symptoms and even destroying the entire kidney. But these are rare, and these large stones are called staghorn stones or large stones. However, most of the stones will come to light when the small stone comes into the tube, the ureter that connects between the kidney and the bladder. This tube, has got only a diameter of about 5 millimeter. And any stone larger than that, when it comes and blocks in this pipe, it gives one of the most intense pain known to mankind. It is a very severe pain which comes in waves between the kidney and to the urinary bladder. It can even sometimes radiate into the genitalia. And this is the pain that comes in waves, and that's how when the patient knows that they've formed stones. Men who have had heart attacks, they feel this pain is far superior and increase in the intensity compared to that. And women who have had children, then they feel that this pain is much worse than a labor pain. So when this pain comes in, then they immediately come into the in A&E, and when they're given pain relief, and the test, which is typically a CT scan of the kidney and the urinary bladder, will show the stones wherever they are located. And then there is a third way of this stone being found, and that's by when the patients have had some form of imaging or tests for something very non-specific, like tummy discomfort and so on. So once the stones are formed, then how they are treated. So I've told you that how they are investigated. A CT scan is the one that shows the stone, and then the stones are treated in a number of ways. If a stone is situated in the kidney and the discomfort is not much, then they could be put onto a machine called the lithotripter or lithotripsy, which means the breaking of stones, and the stones can completely fragmented or broken in the kidney, and the patient will pass these stones as tiny fragments or sand in the urine, and the stone is treated. But for majority of the stones that I mentioned who come with the severe pain, then the stone, if it's not passed, then it gets stuck in the tube. So these are the stones who require procedures or surgery, but we're not in the olden days cut these patients or do anything more drastic. All we do them and treat them today is by very sophisticated telescopes which go through the urinary passages. It's almost a pee-hole surgery. You go through the pee-hole and go into the tubes and go into the tube between the kidney and the bladder or within the kidney, and using very fine laser fibers, these stones are then broken and made into fragments or sand which the patient passes urine. To enable free passage of urine, after breaking the stones and treatment, we might pop in a special tube called the stent within the kidney, within the ureter tube, so that the kidney is all protected. The recovery after these telescopic operations is very quick. About 80 to 90% of the patients can go home the same day after the operation, and the majority would go home the next day. And even for patients who had the PCNL or the keyhole surgery, they go home typically in about 48 hours when the tube from the kidney is all removed. And they can go back to work very quickly within the next week, and they can resume all the work, and even they can start working from their computers and so on the next day, sending emails, etc. So the recovery is normal, and once it's all done, they can even start eating the same once they recover from the anesthetic. So there is no restrictions on any of those things. It's an important question because kidney stones is something which is recurrent, because I mentioned most of the issues with the kidney stones is because of our diet and our the way we live and the way we eat, etc. So, and we also know from statistics that 30% of patients, is 1 in 3, will form another stone in 10 years, and about 50% or 1 in 2 patients will form if you wait for longer. So it's very important as to what do we do with the stones and how to prevent them from forming the stones. And when the patient had that severe pain once in their life, they do not want it again. So what we do is a number of things. We have what's called a metabolic stone unit, where a metabolic stone person does a number of tests of the urine and the blood, etc., to find out whether people have some of the metabolic abnormalities, like for instance, the parathyroid gland in the neck may be overactive. So these things could be corrected, and there are certain changes where you can pass excessive calcium in the urine. Again, there are medications to stop this happening. And once these tests are done, we also give them an extensive, tailor-made, individualized diet sheet. So what, depending on the problem an individual has, so that they don't form stones. While all this is happening, the simple message from us is that have moderation in your diet, have less of red wine. Don't stop anything, but have moderation in all the things, in chocolates, nuts, etc.